There were 3 Abisims, Abisim number 1, number 2, number 3, all of my father's villages in Akumadine, to Mantis Krum, 65 years ago. Attended the primary school, middle school in Akumadine, Methodist, LA, Presby, and then on to Opokuware. Secondary school, Form 1 to upper, and then came to Legon, became a medical doctor. And then work in several places. The rural setting was my hobby. And every now and then, from Kolebu to Bato to Akwatia to Nkoko, and I was in your area too, Agogo, the original 1980 rural health, community health development in Agogo area. And then finally, in the revolution time and a comrade, I had a stint of 5 years in Liberia, and then came back and finally settled in the village called Kasey. And I've been there since 1988. And from there, after about 10 years, came back to Emmanuel I to develop the whole setup. So Dr. John Oduro Boateng is a medical practitioner. Yeah.
You said the rural setting is your hobby. This is very unusual coming from a medical officer. What are some of the values that have shaped your worldview, that have shaped your professional life, your work as a medical officer, and maybe your entire life? What values do you cherish so much?
Well, in our Ghanaian community and our Ghanaian setting, and also in the third world, the major needs are in the rural areas, where nearly 60 to 70% of the population live. And that's where most of the needs are in terms of health services, schools, water, name it. And so that's where the action is and where the need is. And also coming out from the rural setting, born in the rural area, and then seeing the plight of the people, and during the medical school, going to the various rural areas, I saw that there's a need there. And being a Christian, I had a call, a passion to serve my own people where the need is most.
Are there people in your life, you said now we've mentioned medical practitioner, you've mentioned your faith as a Christian, your whole rural setting, you mentioned your former school, Opokuware Medical School and other places. Are there people who you consider have made significant contributions on your life, have served as mentors, people you look up to?
Yes, there are quite a lot, especially my teachers, some of my pastors, and some of the elderly Christian leaders who, during our SU days in school, helped us.
Scripture Union.
Scripture Union, like Wafaedi, Mr. Kwabena Opuni. They were people who used to come to us. I remember Reverend Kwame Anson. They used to come as, we looked to them as quite elderly, those who've made it, yet they have passion to reach out to the young ones and also to reach out to the communities. So I've had quite a lot of people who have impacted me as teachers. Remember Teacher Redu in the medical school, Prof. Bedu, Prophet Champong. These all impacted me one way with certain values, hard work, honesty, sincerity, and then a passion and commitment to help others. Reaching out to others. And I remember when I passed the common entrance, my uncle, Oduro Boateng, had to borrow because my father had died, and then he went out to borrow and ended up in court, and he was bold to say, Kofi, open ye our bread. That means if you want it good, you have to work for it.
Yeah, viewers, I've been in conversation with Dr. John Oduro Boateng, the CEO, Emmanuel I Medical Center. He's a regional coordinator, Africa regional coordinator for the St. Luke Society. And then also there's a hospital around Ejura that he is still the director. We'll come back to that later. But Dr. Oduro Boateng, when I go to Eye Medical Center, I hear concepts like eye specialist, ophthalmologist, optometrist, optician. These concepts that I hear in eye centers, what do they mean? Do they mean the same thing? What are the differences between eye specialist, ophthalmologist, optometrist, and then optician? Who are they?
The ophthalmologist is a medical doctor who has gone on to specialize specifically in eye care. So he is a doctor.
He or she?
She or he.
Okay.
At Emmanuel, we have all female specialists.
Oh, okay.
So an ophthalmologist is a doctor who has specialized 3, 4 years, 5 years in eye care. So he can do eye surgeries of all kinds, especially cataract, glaucoma. He can also teach other health professionals like ophthalmic nurses to become paramedical service personnel. So ophthalmologist is the highest person in the eye care. Okay. Then we have optometrists. Now we're blessed with 2 optometry schools, Cape Coast and Tech. They are doctors who specialize in the refractory errors of the eye, leading to eyeglasses.
Your people who understand the word you are using, what does it mean?
Refractory errors are just eye conditions relating to inability to see far or see near objects. So that because individuals vary in their the lens power, the eye lens, you have to measure it according to the individual so that he can get glasses on. So these are the optometrists. They are also equivalent to opticians. The same, they are used interchangeably. But the opticians are specific in dispensing glasses. But the optometrists go beyond just dispensing glasses. It's able to diagnose the type of refractive error. That is the type of eye not seeing, and then be able to prescribe. They, because of the length of their training, they also do part of the work of ophthalmologists, the eye specialist doctors. So they are able to come alongside the eye doctors, the ophthalmologists, to diagnose glaucoma and treat, and also help in the whole care system.
You started mentioning glaucoma. What are some of the common major eye condition challenges that we have in Ghana, especially those of you managing eye care in this country?
In now setting, number 1 is cataract, where the eye, the black that you see in the eye, that makes you see become opaque, or it turns white. So there's total blindness in one eye or both. That is cataract, and that is corrected only by eye surgery. Then there's glaucoma. That is the internal eye pressure, for one reason or the other, increases, so that it needs to be measured and treated by either drugs alone or plus drugs and surgery. These are the 2 top. There are other things like allergies, infections, trauma, foreign bodies. These are all common eye conditions.
But has primary eye care been integrated within the primary health care in Ghana? Some of the things you are mentioning.
The primary eye care conditions is part of the primary healthcare system. But because individuals to take care of the primary eye care centers, like in the rural areas and various hospitals, rural hospitals, they need people trained to identify the eye conditions. So, for example, a district hospital without an ophthalmologist or optometrist, the medical officer there is able to diagnose cataract, eye infections, but to diagnose glaucoma, additional equipment is needed. Hence, the need to train middle-level eye care professionals named ophthalmic nurses. That is, nurses who've done degree nursing or diploma nursing and then gone on to 2-year, 3-year training to get some aspects of eye care which they can diagnose as middle level.
But glaucoma and some of the things you are mentioning, you are talking about elderly people. Do we have eye challenges confronting children, primary school children? And how do we know? Because, you know, when children are not doing well, all that we know, as we say, nakawabong, without sometimes even finding out whether the children are seeing very well. At what point, especially eye challenges confronting children, do we know that this child is having eye challenges? Not the glaucoma and the cataract that normally elderly people that now they know they have problems, so they want to walk to the hospital. Children, how do we know?
Some of them in children are very obvious. The allergies, you see the child rubbing the eye all the time. That means he has a specific allergy, usually associated with asthma, and that can be taken care of at the primary level. Some of them infections.
Help my viewers. So if I'm a parent and I have a 12-year-old child, P6 child, who is always, you know, doing that, I should not just take it that the child is having fun,
No.
the child, but what are you saying exactly? Help my viewers to. I mean,
Well,
we see children do this and it doesn't, you know, it's unusual.
Yeah, it's very unusual for a child to always be rubbing the eyes. And you can see the coloring, it turns brown. And they might be wheezing or sneezing or have asthma. So this is allergy-related eye condition and can easily be handled at the primary level or at a referral level. There are refractive errors right from...
Just for the sake of my viewers, refractive errors means what?
Refractive errors is simply the eye cannot see either long objects or long distance or short distance.
And you mean children?
Even in children. And this is what affects most of the children who are very brilliant but perform very bad at exams, because when they sit behind, they can't see anything. When they sit in front, they can't see anything. And even when exams come and they are reading, they can't see anything. Then they write anyhow. So these children whose performance are not very good, and situations arise where they fail totally and they find it difficult going to school, then this is purely a refractive error, reading error. So if the parents take him or her to an eye clinic, then it can easily be diagnosed and treated with simple glasses.
Dr. Oduro Boateng, this is not something we commonly do. Normally, if a child is not doing well, a typical Ghanaian parent will look for extra classes, a teacher to come to the home to teach. This is not something we do easily. And our schools, children who are not doing well are maybe beaten and sometimes publicly insulted, wabong, and you know, do we often send such children to eye centers that it's not only the cognitive, the brains, but maybe if a child is not doing well, the eye is also contributing to this factor.
Fortunately now, there are school programs going on all over the country. For example, our clinic in Kasai, our hospital, will go out to schools. So these can easily be detected. And this also goes to some of the teachers and some of the parents, where just simple observing the child. You can give a paper to the child and then they start reading, they can see or they can read. And this helps. So it's a whole process of education, both to the parents, teachers, and even some of the children themselves.
Viewers, Dr. Oduro Boateng is saying something very important, that if a child is not doing well, among other things, yes, we need all the extra classes, extra effort, but we also need to examine, especially the reflective, the eye conditions. Don't let us even worry ourselves with the technical concept he's using. And when we find children rubbing their eyes, don't just leave the child alone. It is a reflection of something. He's saying that it can even be asthmatic symptoms or other things. So teachers, let's open our eyes. This may be one of the ways we can help children. And parents who can send their children for such eye examination, the way Dr. John Oduro Boateng is presenting the issue, we must be fast and take much effort in helping our children, rather than pushing them to the corner that they are not doing well. There may be other challenges, but daily graphic.
But now the school program where health workers go to various schools, both primary, middle, and then the secondary school to examine. They usually go in a team, dental, eye, general. It helps a lot with health education. And then also in the schools, the health education aspect of the curriculum should be emphasized. And head teachers, headmasters should make every effort, because the health of the student is directly related to the student's performance.
Now, Daily Graphic put up a story, I want to say, a very worrying story, latter part of last year, that the 91 ophthalmologists in Ghana, 75% are in Kumasi and in Accra. And the painful part was that some regions did not have single ophthalmologists. Mentioned then before the creation of other regions, Upper East, Upper West, that these regions then last year, latter part of last year, did not have single ophthalmologists. Has the situation changed?
Well, with the Upper East, Upper West, it was purely, especially the Presbyterians had a very good eye hospitals in Boko with 3 or 4 ophthalmologists. But because of the problem with the conflict, a lot of them moved down. Now I think it's improved. But the main reason why Accra and Kumasi alone takes the chunk of the ophthalmologist or the eye care professional is that is where the teaching hospital is. It takes 3-4 years to train an eye specialist. So most of them have to come to Accra or Kumasi to do their training. And then because they have to do further trainings, there is retention. Unless there is definite effort by the health institutions from the districts, say in Agogo or Kasai or Diayankanta, to make a proactive effort to send doctors for training so that they come back. We call it release and sponsorship. So in Kasai, we have released one to come and do the training, and then he's coming back. Emmanuel, currently we have 2 we have released to do training. So in a field where there are not that many specialists, effort has to be made by the heads of the various institutions to train and retrain so that they attract them back to the institution.
Dr. Oduro, are you worried about the quality of eye care services in Ghana?
Currently, with the trend in terms of ophthalmic nurses and the doctors, I'm not worried at all, because there is enough hands to handle the situation. But my worry is lack of effort to help more young doctors and young nurses to go into training so that the numbers can be increased. And then effort should also be made that equipment is made available. Because if a person goes for training and there's no equipment to use, it becomes very difficult. So there is both the individual health institution heads and management to proactively plan and make this available so that the personnel, the equipment, and the places to work are available for us all in the country.
So now we have improved healthcare delivery system in Ghana, national health insurance. But I still find people who will send their eye challenges to pastors, malam. In fact, I have a story about somebody who was having a problem with the eye and was advised to use lime, and lime was squeezed to the eye. Now, why will people do this?
Well, we still have various groups of people having access to the media or to the churches or to various platforms to market what they have. So that is the biggest problem in buses between various towns and cities, even on the radio, various media. You can see people just selling their products, what they have, what they can do, when there's no basis. Unfortunately, we don't have advocates or law enforcement to really challenge the basis of this, like the Medical Council or the Medical Association or the Nurses Association. They should also have a voice or proactively set up media and programs to educate the public about the dangers of these hazardous health practices going on all around.
But do you have that at, say, your center, Emmanuel Eye Center, that people bring eye challenges that they have spent time at the prayer camps with malams, self-medication, to a point that a situation that could have been helped, but they come when it's too late? Do you have that?
Yeah, unfortunately, we do have now and then such situations. Even some of them have had the needle they used to take snail, these big needles, puncture their eyes just to take out the cataracts. So
no. They do that at home or where?
Home, because of lack of knowledge, and these people go around. So we dedicate 2 or 3 days, both in Kasai and then at Emmanuel, specific for health education. Every morning we have a morning devotion between 7 o'clock and 8 o'clock at Emmanuel, and then in Kasai 7 to 8, where we give health talks. And then we do health outreaches to Boduasi area, to several other places. And then we give health talk about the importance of reporting any condition, symptom of the eye or body to the hospital, because that's the only place where people are trained to help you. So
you mentioned your morning devotions. Does God heal in our hospitals?
Well, as a Christian, I believe in what the Bible says, that these signs shall follow them that believe in my name. In my name they will lay hands on the sick and they will be healed. And Jesus went about doing good and healing people. So being a Christian and being an African and coming from our setup, people, whenever they are sick, that is where they are the lowest end of their emotional life, and prayer help. We have people coming, and more especially when the condition pertains to the eye. There is fear of the unknown, and the prayer, assurance, and then just talking to people that it will be all right helps a lot. So I believe in the power of prayer, the word of God, and the same old Jesus Christ of yesterday, today, and forever. His power, it has worked. But that doesn't take me off the scientific, excellent clinical practice to diagnose, listen, diagnose, and treat according to proper medical work.
You are suggesting something that we may need interfaith between, call it faith or religion, and science. You know, that faith must not frustrate what science must do. And maybe science must also give in space to religion. Faith matters. At the moment, there is this perception out there that when you have certain diseases, you said that the fear of the unknown, maybe some witches somewhere want to, destroy something. And so we get pastors who will want to stay in the realm of faith and religion, and that is the point now. In the name of Akwanchire, you give lime to somebody, which is acidic. So how do we also help our religious people, Christian leaders, Muslim leaders, to appreciate that we must pray, but prayer and faith at a point must also give space for people like you to do your work?
Well, if an individual is made up of the soul and the body and the spirit, so we are a holistic individuals. Communities are holistic. So that we can never take out the soul aspect, which is linked with the spirit and the belief of an individual. So, but we are also intelligent human beings, given the intellect to study and to make the decisions that are proper and right. So faith and science have an interface. Faith does not take out the conscience of an individual, the will of an individual, the individual's personality out of what he or she is endowed with. That's why we can not all be pastors or all doctors. We have distinct individual personalities and their gifts and talents, so that the individual can perform as a banker, but has to interface it with his face. A doctor has to interface it with his face so that the common good can come about. Recently, not quite long ago, I was in the consulting room, and this big man, a politician, walks in. Then he said, I can't work again as a whole district chief executive. So I said, okay, all these people were following him. Then I could sense he's deeply depressed. So I asked his entourage to excuse us. And then we closed the consulting room door. I could see that he was really depressed. He was really agitated inside. All I could sense is, my friend, you've gone to some malams or you've gone to do some juju. So it's affecting you. That's why you can't work. Then he said, how do you know? I said, what you are saying and with your work, it doesn't correlate unless there is a spiritual element. And within a week, he brought all the concussions to the clinic. We baptized him, he's free, and he went back to his work.
Medical doctors are also men of God. But viewers, I'm in conversation with Dr. John Oduro Boateng, who is saying some very important thing, especially the faith people in our society, and these days that religion is everywhere. The impression is if you have certain medical challenges, the place to go is where you get the man of God, the woman of God, the malam. But there's nothing wrong going to the hospital, because in our hospitals, our health facilities also, God heals. The Christian God healed in our hospitals too. So it should not be that when I go to hospital, it means I don't have faith in God. In fact, the people who are in our hospitals, some of them are also men and women of God, like what the story he has just mentioned told us. And colleague pastors, let's encourage church members to go to hospital where they must to, and pray with them also for God to give them the divine intervention, rather than keeping them at the prayer centers and prayer camps and worsening certain things for them in their medical challenges. But Dr. Oduro Boateng, what does it mean to say that a medical center provide non-commercial but cost recovery basis healthcare in Ghana?
Well, there is cost to everything. And the Americans will say there's no free lunch anywhere. To set up a health facility, to get drugs, and to get workers, the workers need to be paid. And the drugs, even if they are given free, it's not free all the time. So setting up our clinics, what we do as a medical mission or Christian center to help lift our people, we do what we call sliding scale. And we are very honest with ourselves and with the patients and people who come, that we don't want to turn anybody away. So we have a fixed price. Fortunately, with the National Health Insurance nowadays, there is a fixed charge per outpatient consultation. But then there come people who for no reason cannot register National Health Insurance. Very difficult. Don't have anything. And they walk in. So we have that chance and opportunity to treat them as people who are poor and are needy. Sometimes we even have to give them transportation, give them feeding.
I come to your health facility,
yeah,
and I'm not able to pick my bills, and you give me transport.
Yes.
This country?
Yes. We give them food, we make sure they go back home. And there is evidence that some are very genuine and they come back. Sometimes some people come back later, even after hernia surgeries, they will come back and pay. But fortunately, there is the national health insurance, though there is some delay, but eventually we are paid. And there are people who come from various places. They can afford and even help with the hospital. Same condition, a hernia operation, some might not have, especially when they come in here as emergencies. But we do it for them. Some come, national health insurance take care. Some come, they pay. They don't care about health insurance. So this is what we call cost effective. We're thinking of the cost, but it's non-commercial. In the commercial case, you come in, you don't have money. We turn you out. But non-commercial, so that we can provide service for all. And God being so good, we keep on providing. There are some certain categories of people we say, because of the nature of your work, you are also helping the community. Therefore, we also give you free service.
Okay, help us here. You are the Africa coordinator for St. Luke Society, and then also CEO of Emmanuel Eye Clinic. Now, what's the difference between Luke Society, Emmanuel Eye, and the other facilities? And what's the relationship?
It's very simple. The Luke Society is an international medical mission, Christian humanitarian organization. What they do is a small office, businessmen, doctors within the Dutch Reformed Church originally, but now there are a lot of other churches, individuals supporting. They started the original Mississippi Delta Care Center for the poor. And then after some years, they found out that there are some doctors around the globe who have real call of God and vision and passion to serve their own people, just to do humanitarian work, go to the villages, help. These are unique individuals. So whilst in Liberia, I got in touch with one of them. That was my main vision and passion in doing health work in Ghana. So they said, okay, this is what we do. This is what you want to do. Therefore, we'll partner. And then through the various registrations, we were able to set up in Kasai. And then started the Kasai, the holistic community development, the hospital. And then somewhere along the line, the Americans who started Cape Coast Eye Clinic were asked to come to Accra. And whilst in Accra, they teamed up with us. And they said they wanted exactly what we are doing in Kasai to be done in Accra. Hence, being a founder in the Kasai Look project, I automatically became the founder here and replaced the director. But because of the nature of rural work and urban work, I separated the two. So we have management team in Accra and management team in the village. Then somewhere along the line, the Kasai project became internationally acclaimed. We even published it in Serving with the Poor. And then they wanted a replication. So they asked if I can serve as a regional coordinator, because the languages, the customs, and the culture of some of the African countries are similar. So they asked me to coordinate. So I'll look for a doctor who has vision, passion like me in Senegal, Mali, and then we will support and I will mentor. So coordinating is totally different from being a director. In directing, you are the vision bearer. You recruit your own management and staff and train. You run your program. But when you coordinate, you just facilitate. You are a mentor and you give directions because of your experience.
You mentioned unique people who are prepared to serve their people. And you are talking about Kase, where you've spent how many years?
33 years now.
33 as a medical officer.
Yeah.
Now, let's talk about community development here. What will let a medical officer, a professional, decide to stay in that community, a Dumasi area, to develop the community, and not to move to Accra, Kumasi? What will let a person like you go that way?
Well, there is the individual's passion and call and vision for life. Some individuals are born and they are purely academics. Nothing would take them out of the university. They will do their PhD and continue their professor and the like. So, well, by God's grace, I was that rural type, and I had passion to reach out to people in terms of various needs, and God, by His grace, gave me skills both administratively, surgically, and medically, and also the other side, doing community interventions in water, schools, microfinance, and credit. So I found that the Lord endowed me with the gifts and then placed me in an area where the need is. So I just day by day, using health as entry point, team up with the churches to plant churches, help, and then team up with the community cooperatives, microfinance, and then currently we have a community bank ranging from Kajeji, Yeji, Atebubu, all the way to Kumasi area. And so basically it's a mixture of my background and then the call God placed on me and how I'm passionate about meeting and doing it well. And God blessed me with very good supporters. My family fully supported what I was doing. And then I had very good support in country, various organizations. I had 4 objectives because doing this work is not easy. So you'd have to do a lot of collaboration and networking. So from day one, I went to CHAC. This is what I wanted.
CHAC is Christian Health Association of Ghana.
Where 88, 89. Then I became a board member for 10 years. And I saw that what CHAC stands for is what my calling is. So I fully dedicated serving within CHAC. And within CHAC, you have to belong to a mainline church. So with Church of Pentecost, Christian Council, everything fell in line. So collaborative linkages took me to UNICEF to bring medicines to the community, to the various community clinics. And then it took me to bigger organizations, World Vision for water projects and the like. Unfortunately, my board chair, Mr. Kwabena, was also on Opportunity International, Snapiaba.
Former Dako Farms.
The former Dako Farms. I knew him since 69 in Opokuare, the town fellowship and the like. So we collaborated in bringing microcredit to the various groups, and then the cooperative, and then establish the Amantin and Kase Community Bank. So there is a whole interplay, but the whole concept is holistic. You enter with health, but don't forget about the community and their beliefs and their Christian worship. And don't forget about what they do to live. You can treat somebody, but because of poverty, no money, no job, he will go back and come back sick. Same person, because of beliefs, the medicine, he will throw it aside and go behind and do the concoctions. But when you bring him to the light of the gospel, he knows that things must be done this way, and it helps.
Dr. Oduro Boateng, is the rural-urban gap in Ghana being close up or being widening? Because you have stayed in the rural communities. You mentioned about 33 years working with communities. Rural-urban gap.
Rural-urban gap. Over the years I've seen it is worsening. Rural-urban drift is also increasing. But unless from the various society stakeholders concrete steps are taken, the drift and the gap will widen. One, government programs where they are cited. Schools, universities, and society major programs that help individual development. If all of it is cited in the 3 or 4 capital centers, Kumasi, Accra, these days Tamale, you see that people will always drift towards, and that also prevents people from going back unless they are going for funerals or their bodies are going to be...
I want you to look straight to the camera, and what you said, that unless pragmatic efforts are being, pushed, you said the rural-urban drift and gap will do what?
It will worsen.
We don't know who is watching us. Repeat those things you are telling us, and the spread of development in this country.
Yes.
Just straight to this camera and help.
If all schools, if all the economic development are placed in centers where only the rich can reach, and the rich can become richer, and people don't go back to where they come from. Like a lot of the people who are heading various institutions come from rural areas. But how many of them go back? You talk about the north. In Kumasi, Accra, there are so many well-to-do northerners, but how many of them go back? So that programs, projects are set up proactively, definitely, within these villages and towns. People will drift back, and it will be very difficult for us to have even distribution of development.
It seems whenever we are close to election, or we are in the election season, we live in a country that we know how to send ballot boxes to every corner of this country, even if the roads are bad. But after election, we don't know how to send development to the same communities. And we give apologies that people should have patience for us. What do we need to do differently to get to what you are telling us? That we should not be a country that know how to send ballot boxes and go to the rural communities to campaign, but we know how to send development to such communities.
Well,
you are not a politician.
I'm not a...
But with what you are telling me...
Politics affects every sector of individual.
Yeah.
But we have our societal norms and values, our society leaders. For example, in Ijura, where I've lived nearly 30 years plus, just last week, the new chief, and his people were able to put up a medical officers building, a bungalow, for a second doctor. For 31 years, I've never seen it done. But the chief of Ejura, together with his people, came together, did a festival, and then collected money from various sources, and then put up a 5-bedroom bungalow. Never happened before. So we have community.
Have you had opportunity to say thank you to Ejurahene?
Oh, I went there myself. I was
Repeat
at the
what
program.
you told him.
What you did is worthy of emulation by our traditional leaders, because that is where you are the head and the custodian of the people. So coming together to do what you did is a great example.
So that community development should also not be at the doorstep of government alone.
Yes.
But traditional leaders, you are saying so many things, church leaders, individuals, because you said earlier on, people move from the rural areas to Kumasi, Accra, Tamale, they don't go back.
Let me tell you 2 or 3 issues. One, community is made up of households, of individuals and their houses that make up the community. If you go into it, it's made up of the chief and the sub-chiefs, the Zongo and all this. They live there, they come from there. So the onus of community development is number 1 on them. And out of these community individuals, the various sectors, will come an MP, will come a professor, will come a pastor. And all these would come and be headquartered in Accra or Kumasi, and don't think going back. So community development, urban rural shift, cutting it off, starts within the community. And the community leaders are very, very crucial. For example, there is a new Church of Pentecost pastor. He comes from a village, a new chairman. He comes from a village, a town, and is a member of that community. And that if he uses his position to bear on the church, the global church, or the headquarter church, say, let us look back. We've had enough of big church buildings in Accra. Let's go and look at these places, so that the church will also be a vehicle of going back, sending back to development. So there is a whole ramification, but if you take it one by one, you see that there is a responsibility for everybody, and everybody can contribute one way or the other.
Viewers, what is next will make a trip to Ejura to visit Ejurahene, because of the story that Dr. Oduro Boateng has said. Community development is a collective responsibility. Yes, those who are handling our tax monies are expected. But what we are hearing from this platform is people should get ready, especially people who came from the rural communities, to go back and help their own people. Families must help. Chiefs must help. So this mentality that development must always come from government, also we are not helping ourselves. Maybe our politicians are giving us that impression, but we need to reorient ourselves. Dr. Oduro Boateng, you said you are a rural person. There are many young people in our rural communities. They wake up in the morning, they don't see hope coming from anywhere. will you use your story to help my viewers, especially young people in our communities, to know that our future is better than our past?
Yes. One, there is opportunity to go to school. Education is key.
You have in mind the free SHS?
The free SHS, even if there's no free HS, there is the primary, the JHS, the SS. Now scholarships are available. As far as you as a young person give your time to study, give your time to values of society, like God-fearing, being a good Christian, respecting elderly people, and doing your part, God will help you. And also there are a lot of opportunities open now, especially those who have done HND, those who have done BSc and the like. Professional courses are abundant all over. And there is this element of volunteerism and also entrepreneurism, where you don't sit to get employment before you can do something. I told you I went to work at Bato, not because of money. They needed help.
Bato is Volta region.
Bato, Volta region, as a young doctor, 83. I went there to work, and then they transferred me to Akwati. I just kept working. In between holidays, I'll go to Nkoko.
Did you see that as a punishment then?
No.
Going to Bato?
I saw it as a joy. Going there, and then the sisters would kneel. Oh God, thank you for bringing us a young doctor. So it was a joy. But these days, young men tied up everything to money. You don't have that volunteerism, sacrifice, and just going for experience. At the moment, after 30 years in Nigeria, I've seen that in order to scale up, in order to help out many people, I've had several consultants developing several big projects like dry season farming, irrigation farming, cooperative farming of various kinds, agro-processing. Fortunately, the government has brought in this 1D, 1F.
So one district,
one factory. So there are so many opportunities. And those of us who have been blessed with contacts and the knowledge and skills, we should take advantage of this and send it back to the village. So whatever project I develop for Ejura area, I develop the same for Akumadan area. I develop the same for Mankranzu area, where my people used to live and I used to stay, knowing their plight. So there are opportunities to take the good things out of the government projects back to the village and then help our people in various aspects. All we need to do is open ourselves to the Lord, to open our eyes to see opportunities, and then utilize this to help our people, not sitting in our comfort zones.
Your last words to my viewers.
Well, this is our time and our generation. The Lord has blessed us as a country with very peaceful environment, stable environment. The government has several programs. The churches are doing several programs. Let's open ourselves onto values of hard work, values of cooperating with each other rather than pulling each other down, loving each other, and then values of giving out to the communities, giving out to others in need, and serving our people. And that will bring up about great change.
Viewers, I've been in a conversation with Dr. John Oduro Boateng. He is the Africa Regional Coordinator for the Look Society. But he is also the CEO of Emmanuel Eye Clinic around East Legon, Accra, and Kasey Hospital at Ejura Sechedumase area. And we are so blessed to have a medical officer. Yes, he's worked in some countries, Liberia, but in rural communities for 33 years. And he's admonishing Ghanaian young doctors that they must be willing to go back, especially those coming from the rural communities. But he's also using Ejura Hene as an example that community leaders, traditional leaders, church people, as well as government, must make conditions conducive for people who want to stay in our rural communities to help. For him, if we don't change the paradigm, then the rural-urban drift is even going to be worse. This is what is next. And this is where time may allow us, but we may need Dr. Oduro Boateng another time. Viewers, this is GTV, the authentic and trusted voice of Ghana. We will come your way next week, same time. Our hallmark is the common good. God bless our homeland, Ghana, and make this country great and strong. See you next week. My name is Kwabena Opuni Frimpong. Dr. John Oduro Boateng, thank you very much.
Thank you, Reverend. Thank you.
Very grateful.
Thank you.